Veterinarians say heart disease in dogs is common and can be caused by several factors. On this episode of the Paw Report, we're joined by veterinary cardiologist Dr. Ryan Fries from the University of Illinois Veterinary Teaching Hospital. Dr. Fries will help us recognize the signs of heart problems in dogs, causes, and various treatment options. Stay with us.
OCA Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. OCA Vet Clinic located at 140 West Sales Street in downtown Tuscola. More information available at ocavetclinic.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this episode of the Paw Report. And on today's episode, we're talking about cardiology, the heart, and our special guest joining us is a cardiologist. And you may say, well, this is a pet show, right? Well, pets have hearts too, and that's why we're talking about pet cardiology and all the things that maybe couldn't go wrong with our pets when it comes to the heart. Dr. Ryan Fries is joining us, and he is with the University of Illinois Veterinary Teaching Hospital. So thank you for making the trip to Charleston to talk to us about a topic that we've never actually investigated here on the Paw Report. So thank you. Also, we should mention that we've got a little friend that's going to be running around the studio. That is Bernie, and Bernie's got a success story about his precious heart, and we'll get to that in just a bit. But we told Bernie just run in and out. That's fine. So thank you for joining us.
You're welcome.
Dr. Fries, tell us about you and your background and how you established yourself at the U of I.
First of all, thank you for having me here to talk about heart disease in our pet population. So I'm an Illinois native. I was born in Chicago and grew up there. Traveled around a bit for colleges, and ultimately I went to veterinary school, and it's a 4-year degree program. After I finished vet school, I did a residency in veterinary cardiology. So very much like a human doctor would advance after their training to do more training. I did my residency down in Texas before ultimately coming back to Illinois and working at the University of Illinois now.
So what led you to the area of veterinary cardiology? I mean, it was something, I have to be honest, I guess I just never thought that there would be cardiologists for our dogs and cats. So what kind of struck your interest in that area?
You know, I was guilty of the same thing even as a student in veterinary school. My experience to that point had been with my family veterinarian. That's what I thought veterinarians did, and I was really excited to do that. That's what I thought I was going to do, and it wasn't until I had started going through the process of training and learning to become a veterinarian that I had time to spend with some of the specialists in the field of veterinary medicine. And specifically in my 4th year, which is our clinical year where we function as little junior doctors with our lab coats, we get to see patients. I got time on the cardiology service, and I got to meet some of these wonderful veterinarians who were also cardiologists, and they really piqued my interest in it. They thought I had a talent for it. They really encouraged me to pursue it. And it just sort of opened up my eyes to all of the different facets of specialty medicine that veterinarians can provide. And I, as a cardiologist, am just one of many specialists at the University of Illinois that provide very high standard specialized care. And so for me, I just have a love of the heart, a heart for the heart, if you will. And so it just naturally, I just kept learning more about it and loving it more and more.
What is, if we could get to the heart of the heart, what is heart disease as far as our pets are concerned? How do you define that? What defines the problem?
Yeah, so the heart, as we all understand and know, is essential for life, right? It is the pump. It delivers the blood and oxygen to all of our tissues, so obviously very important. Dogs and cats get various types of heart disease, just like people do. We can acquire diseases in our lifetime. We can be born with different heart diseases. Sometimes it's the muscle, sometimes it's the valves, sometimes it's a combination of those things. And so we define, heart disease as any disruption in normal heart function. So the heart has a couple of different facets to it. Not only is it a pump that moves blood through our bodies, but it also has its own inherent electrical activity. So dogs can have problems with their heart rhythm. They can have problems with their heart function, their pump, and various different forms of heart disease. So anything that starts going wrong with that is how we define heart disease. And then specifically as cardiologists, we work with the family veterinarians to tell owners what specifically is the problem.
Mm-hmm. What are some of the, Bernie's checking out the set behind us here. What are some of the signs of heart disease? Now, you mentioned there are some congenital, there's congenital heart disease and there's acquired. Maybe you can get into that a little bit more and then talk about the signs, because sometimes the signs aren't obvious.
Yeah, that's exactly right. Our patients, they never tell us, which is always the challenge to our jobs, but it's much like, a pediatric cardiologist. How do they figure out that an infant has a problem? It usually starts with an observant owner or parent. They notice that there's a change in their pet, whether it is a lack of energy that they used to have, maybe their walks become more difficult for them, or sometimes it can be more obvious that they're having difficulty breathing, shortness of breath, coughing. So sometimes the symptoms can be subtle or overt depending on the issue, but typically a lot of these heart issues are discovered on annual or semi-annual visits to the family veterinarian. So your veterinarian has a stethoscope, they're going to listen to the heart, they're going to listen to the heart sounds, the heart rhythm, they can check a blood pressure, just the same things that your own family physician would do for you and your children, our family veterinarians do for our pets.
I read somewhere that you could also check gums and also check the coloration. Is that true? Is that something that pet owners can do too? If the mouth, the gums start turning a little bluish? Yeah,
certainly the color of the gums of a dog should be reflective of their blood flow to their body. Just like we have healthy pink gums, so should dogs. And if there is a change in that coloration from what you normally see, that could present as an issue. You just have to be aware that, if you haven't checked your dog's gums before and you do for the first time now, some dogs have dark colored gums, pigmentation to their gums. So I typically, recommend that it's a change from what you are used to normally seeing. So it should be nice and healthy and pink, but there are some exceptions to that, of course.
What is the most obvious sign? So a dog comes in like Bernie, and we're going to talk about Bernie's story in a bit, but a dog comes in and you just know that's a telltale sign.
Sure. So to me, it's usually a combination of what is the owner telling me is going on at home, and then what am I finding during my physical exam. So to me, if I have a dog who has difficulty with exercise and they didn't before, if they're having trouble breathing, they're keeping owners up at night because they just can't get comfortable, they're having a hard time, and then I listen to that dog and I hear an abnormal heart sound, typically what we call a murmur, to me those are really the telltale signs, and I'm going to then recommend tests to diagnose the underlying condition that we think is going on.
Can you talk about those diagnostic tests that you perform, not just listening, but there's probably a sequence of things that you go through as a cardiologist?
Yeah, many of the tests that I perform can be performed with family veterinarians, which is great because I can't see every dog in Illinois, but certainly I can help a lot of dogs. And so what we typically start with are x-rays or thoracic radiographs, so x-rays of the chest. And what we see is the size of the heart, and we can also evaluate the lungs. And heart failure for most dogs results in a big heart and fluid that can accumulate within the lungs. And you can see that on an x-ray. So that's almost always the first thing that I want to do for a dog who's coming to me that we think has heart disease and is having any symptoms, coughing or trouble breathing. We also will evaluate the rhythm of the heart, and we can do that with an electrocardiogram or an EKG, and that will tell us if there are any abnormal heartbeats, because that can also be a symptom of heart disease, or at least part of the management process if they do. And then finally, at the University of Illinois and other specialty hospitals with cardiologists, we'll perform an echocardiogram, which is an ultrasound specifically of the heart. And that's great because while an x-ray can tell you if the heart's enlarged, and it can certainly tell you if there's fluid in the lungs, the echocardiogram can tell you, how does the heart work? How is it squeezing? Is there something abnormal about the muscle? What do the valves look like? Gives us a sense of function and structure that you just can't always see on an x-ray. And those diagnostic tests together, 90% of the time are going to give us the answer as well as our recommendations for treating.
Once you go through all the diagnostic treatments that you just mentioned, there are a variety of different heart problems. You mentioned some of them, but maybe we can talk a little more at length. An enlarged heart, heart murmurs, heart worms, and then there's all sorts of valvular problems. Let's start with an enlarged heart. What exactly is that condition?
Sure. So an enlarged heart means that if you were to look at the size of a dog's heart relative to the size of the dog, right? We've got dogs like Bernie and we've got big Great Danes. So heart sizes are different. People generally have one size heart, man, woman, child, it's about the same size. So we have to keep that in mind when we are evaluating our patients. But essentially the heart is a dynamic organ and it's capable of remodeling and changing depending on the influences to the heart. So if you have too much volume, either your valves aren't working or you have a shunt or something that's causing extra blood to flow through the heart will get big in response to that. Also, if the heart has to work against a lot of pressure, it has to work really hard, the muscle will get stronger and thicker, just like your bicep will if you go to the gym. And so your heart can enlarge because of the workload placed on it. And we can identify that by simply looking at it globally, take an x-ray or do an ultrasound. So that condition just means that the heart now is adapting to something going on. What that is, though, we have to do a little bit more testing to quite figure that out.
What about murmurs and heartworms?
So
two totally different things.
They are different, but they are both conditions. So a heart murmur is an abnormal heart sound. So when we listen to the heart and we use our stethoscope, we should really only hear two things: lub, dub. And you learn that back in high school, lub, dub, lub, dub, lub, dub. That's what the heart does. If you have a murmur, there's an abnormal sound, and it's usually the result of turbulent blood flow, whether that's because a valve that closed allows blood to go back across it, and that's something called regurgitation, or maybe the valves never opened all the way and blood has to accelerate through it. We call that stenosis. And those two conditions, among other conditions that we see, will create turbulent blood flow, and it makes a whooshing sound when we listen with our stethoscope. And that's what a murmur is. So that's something that we detect on an exam, and then we dig a little deeper to figure out what it is.
And heartworms.
Heartworms are a very important disease of dogs and cats, especially in the southern United States, but definitely in Illinois as well. So heartworms are not the typical worms that you have heard about before, where your dog might pick it up at a dog park, or it comes out in the poop or the back end. Heartworms are transmitted by mosquitoes. So any dog anywhere in the United States that there's a mosquito is at risk for potentially contracting this disease. So the mosquitoes bite the dog and inject these worms that then grow up and travel into the heart. And so because it is a devastating disease and it can result in the death of a dog, it is recommended that your dog be on a preventative every month to keep those worms from becoming infective and into the heart itself.
You brought along Bernie today, and
Hey,
he's
Bernie.
so inquisitive. Come here, Bernie. But Bernie has a story, and you brought Bernie because he's a heart patient.
He is a heart patient. So Bernie was born with a congenital heart disease. So congenital meaning something that you were born with. And his specific disease was that his pulmonic valves, so the valves on the right side of the heart that allow blood to go into the lungs, never fully opened all the way. So they were what we call stenotic. So he had pulmonic stenosis. And when he was only about 7 or 8 months old, he underwent a procedure where we inflated a balloon across his valves to get rid of those attachments that would allow the valves to open up normally. And as a result of that, Bernie can now pump blood into his lungs normally, and as you can see, he's a very active, happy, running around dog. And that is just one of the many things that, as cardiologists, we can do for our patients.
What are some of the other things that you can do as far as treatment for animals? You know, I think, and I had a lab that had an enlarged heart, and I think anytime you think heart, you associate that with the end. You know, that there's probably not much you can do, but there's a lot that can be done.
Absolutely.
Tell us about some of the treatment options.
Sure. So the first thing about any treatment is what's the underlying problem. And so let's take Bernie, for example, or other dogs who are young with heart issues. So a lot of the congenital heart diseases are things that we can repair or cure altogether, fix them. And so there's a variety of those that we can use a procedure. We call them interventional procedures. We can place balloons and stents and wires and different things to open up, repair, and plug the various issues that young dogs can have that will then allow them to grow up and become older dogs, you know, get old dog problems. Older dogs who develop heart disease, for most of them, it's not something that we can cure or eliminate altogether, but it is something that we can manage. And the tenet of therapy now in dogs is medical management. So we use medications to control the symptoms and give them a very good quality of life. And through the course of decades of research and work, we've developed drugs now that can work in dogs that will help keep them alive for years sometimes with heart disease, and certainly with heart failure we can keep them going for quite a while, whereas before and that was true that for many dogs it sort of was the end, and it was a short life that they would have left. Now we give them quite a bit of time back.
What are some of the technologies, marvels that you see on the horizon? You know, there are diuretics and medicines and things that you just talked about, but there's probably some things that are evolving.
Absolutely. Cardiology is a wonderful field. We know that people get a lot of cardiovascular diseases, so there's a lot of research and time put into understanding the heart, and pets are actually a big part of that. Many of the diseases that our pets get are the same ones that people get, and so our animals can benefit from the same technologies that are being introduced in human cardiology. So for example, pacemakers, right? So dogs can develop heart rhythm abnormalities that result in a very slow heart rate, and they can develop symptoms from that, fainting even, weakness. And we can place pacemakers in dogs. We do that at the University of Illinois quite a bit. And the great thing about that is it gives them their life back, and it allows them to, again, continue on having a great quality of life, doing what they need to do. The other areas that I think are very interesting and intriguing in terms of our pet population is that the number one disease that we see in dogs is valvular disease, degenerative valvular disease. So the valves of their heart thicken and degenerate over time, and that results in blood regurgitating and enlargement of that heart, and ultimately heart failure. So the problem with that heart is the valve, and the cure for that would be to repair or replace that valve. And we have struggled with finding a way to reliably repair a valve in a dog, but there are new technologies on the horizon that may allow us to replace them either through a catheter or through a very minimal surgery, as opposed to an open heart full surgery. So that technology is on the horizon. People have been working very hard to try to solve that issue, and I hope that once we do, we'll be able to offer a cure for this problem that afflicts most of our patients.
What about, we talked about Bernie, and I feel like most of what we've talked about is geared towards dogs, but you said, as a matter of fact, cats are just as prone to having cardiovascular disease.
Absolutely. So cats, we see a good number of cats overall in terms of the number of patients that we see on a daily basis. Cats get different types of heart diseases than dogs, but they are absolutely at risk for it in their lifetime. And so the symptoms in cats can be a little bit more subtle. Cats in general tend to be a little bit more difficult to read. If you've ever owned a cat, you might
I know what you mean.
know
they're
that.
kind of aloof.
They can be, but they can still have some of the very same issues: difficulty breathing, hiding more, not eating as well. And just like with dogs, x-rays, ultrasounds of the heart, we can usually get to the bottom of it and treat them appropriately, giving them their quality of life back.
Your dog or cat has been diagnosed with a heart condition. How should you, as a pet owner, how should you treat living with a dog with a broken heart, so to speak?
Good question. So depending on where you are in the stage of disease overall, so let's take valve disease as an example, because I think a lot of pet owners have probably encountered that or know someone who has at this point. And so valve disease is a long process. So it first starts with that leak of the valve, and so that sound. And at that point, there's nothing to be done. Dogs do great with that. They can go the rest of their life and never have an issue with that. As their heart becomes enlarged, we'll start modifying some things. One example is diet, right? So diet is important. We like dogs to be on a good, well-balanced diet appropriate for their age. And of course, we do start cutting back a little bit on treats as their hearts get bigger. And salty treats are the culprit in our patients just like they are in people. So we'll say, cut out any potato chips. Some of the raw hides and other things can have quite a bit of salt in them. And then ultimately, the goal of treating heart disease is for our patients to not know that they're sick. We don't want you to have to treat them with baby gloves. We want them to feel like they can run around, that they can play, that they can be a dog. That's what we want for them. And so, as I tell most of my owners, you're the one that's going to have to carry the burden. You're going to have to know that your dog is sick, but we don't want your dog to ever know that. And that's truly how we want you to treat them. Treat them like they've always been treated, and just do the little things that we ask you to do.
As we wrap up, we've got a couple of minutes here, Ryan. Let's talk about maybe some success stories that you, just in your years of practicing, maybe a dog or a cat that just comes to mind. You remember their story, and kind of would put an ease to a pet owner's mind out there that has an animal that has a condition.
Sure. I have a lot of success stories, and I'll talk about two of them. One, sort of like a Bernie story, where a dog presented to me, and this dog came in for collapsing. He was normally a very energetic, very happy dog, but the owners noticed that when he would get excited, he would collapse. He would faint and fall on the ground, and this was very frightening to these owners. They didn't know what was going on with their dog, and through the process of working with their veterinarian and then ultimately coming to me, we determined that he had an abnormal heart rhythm. And by identifying his abnormal rhythm, we were able to recommend a treatment, which was to put a pacemaker in him. And we successfully placed his pacemaker, and I'm happy to say that he is a happy dog running around. He gets very excited when he sees his owners, and they don't have that fear anymore of what's going to happen. Is he going to faint or collapse? And he doesn't do that anymore. And so to me, those are wonderful success stories. Something as terrifying as your dog collapsing to, hey, he's okay now.
Yes.
And the other story would be less of a we fixed everything and nothing happened. It's the dogs that come in who are in heart failure, right? And these are dogs who are having trouble breathing. They're not energetic, and the owners are scared because their normal happy dog seems like they're in distress. And by coming in and sitting down with me and talking about what the problem is and getting them started on the appropriate medications, I'm able to give them their dog back. And even though I can't give them their dog back for 5 more years or 10 more years, I'm able to give them that quality of life that they've always wanted for their dog. I mean, that's all we ever really want, is our companion to be with us and to be happy. And I really feel that I can do that. I can really help a lot of people in that regard. And to me, that's a success story, because that's what we all want, is our dogs to be happy.
That's right.
And our cats and our horses and our pigs and
That's
everyone
right.
else.
A heartwarming story to end this episode on heart. And I love your saying, I want to, help people give their dog back. And I think that's the key there. So thank you so much for spending some time with us here on the Paw Report and bringing Bernie. He's finally chilled out a little bit.
Yeah.
he had his time running around and sniffing, and he's just chilling out now. So thank you for coming on the
You're
Paw
very
Report
welcome.
today. Thanks, Bernie. Hey, thanks, Bernie. Oh, he's rolled over wanting me to scratch his belly. And we thank you for joining us for this episode of the Paw Report. We'll see you next time. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
OCA Vet Clinic in Tuscola and Dr. Sally Foot remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. OCA Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at ocavetclinic.com.